My second question for this live this morning is, why do women at risk of diminished egg reserve and early menopause, why do they have low AMH levels?
Yes, this is like we said in the spectrum. Yeah, like yesterday we said, the egg reserve is a body parameter. Body parameter means some people short, some people have a medium height, some people are high. So this is how their genes determine, of course, all the factors as well, but genes determine that their height. Yeah. So similarly, their genes, women's genes determine how many eggs they will be born with. Yes, there's some other factors, but primarily 80%, more than 80% is determined by genes. This is why if, PCOS runs in the families. This is why early menopause runs in the families. This is why premature ovarian insufficiency runs in the families, because their families, they have a gene which is responsible for creation of eggs, and that gene allowed them to be born with a less number of eggs. And if they're born with a less number of eggs, they run through the eggs much quicker. Like yesterday we said, every day you lose 24 eggs or so, which is every hour you lose one egg. If you have a PCOS, if you have like 2.5 million eggs, even if you lose one egg every hour in average, so even after the age of 60, you still will be releasing eggs. But if you're born with 100,000 eggs, if you lose one egg every hour, you may run out of egg reserve at the age of 25 or 30. So this is primarily determined by genes. This is why women whose moms or aunties who had the premature ovarian insufficiency in early menopause should be alarmed and immediately do AMH and antral follicle count, and to determine their own egg reserve. And they should project their egg reserve to the future when they want to have kids. Then they should know that if they have a low egg reserve, they need to have kids much earlier by trying naturally first, if it doesn't work, fertility treatment, or preserve their fertility by preserving the eggs or embryos. So the two things we need to define. Yeah. So there are three things we need to define, or four things even. First one is a late menopause. That's a menopause after the age of 55. So that is a late menopause. So this is a women with PCOS who have a late menopause. Then you have a normal menopause. This is it between age of 46 to 56. So average age is 51, 52, but anyone who has a menopause from the age of 46 to 56 have an average egg reserve. So then you have early menopause. That's from the age of 40 to 45. So that's early menopause. They are born with a low number of eggs. Then you have a premature ovarian insufficiency. That's when you have a menopause before the age of 40. It can even happen at the age of 25, 30. That's rare, but still women unfortunately can have a menopause at the age of 20 or 22, which is very, very rare. I don't want everyone to get alarmed. That's very rare. But overall, 1% women have a premature ovarian insufficiency. Let us say if if you're in the school, you have or in the university, let us say university, you have 100 girls at the same age, one of them have a premature ovarian insufficiency statistically. So that's 1%, and 5% of population women will have an early menopause. So let us say 6 out of 100 affected. So if they are not aware, they may run out of egg reserve by the time they try to conceive. That's why everyone should be aware of their egg reserve. That's very important to do fertility screening by a couple of AMH, couple of antral follicle counts, so that you're aware. You don't have to get alarmed, just you're aware what's your actual egg reserve, especially if you have a family history of early menopause or premature ovarian insufficiency. So so that's why this 1% has a premature ovarian insufficiency. Why 5% have a early menopause is because this is a lowest 1 percentile of women who are born with egg reserve. Let us say 100 women born with a different level of egg reserve. So when they're ready to have kids, let us say at the age of 20, if they track their egg reserve, you can see 1%, which were born 20 years ago, born with low egg reserve, have a very low AMH, low AFC, and they keep going. At some point before the age of 40, they fully run out of egg reserve and they have a menopause. But there is a time before menopause, your AMH goes down to zero, antral follicle goes down to zero, and there's a time. This time can be different in different women. It may last 1 year, and another women 3 years, the other women 5 years. So you have a very low fertility left. You're still releasing eggs. You still can get pregnant. Your AMH is 0.6. Your AFC, a number of follicles on your ovaries, 4 or 5. But this time is critical. Women should use a fertility treatment. They can try until they start the fertility treatment. If they get successful pregnancy, excellent. If not, they should use a fertility treatment to maximize their chance to have a successful pregnancy or preserve their fertility. Usually, at this with this AMH, it's difficult to do egg freezing, but they can preserve embryos by using donor sperm or their partner's sperm. So we will define the menopause. Menopause is defined by stopping period for more than 12 months, having AMH less than 0.6, and FSH higher than 30 milliunits. Yeah, so if the three things happens, then that means this patient is gone through the menopause. But there is a perimenopause where your periods become irregular every 3 months, every 4 months, which means you're ovulating, yes, every 3-4 months, because there's less and less number of eggs left. So before perimenopause, you have a diminished egg reserve. You have a critically low AMH, critically low AFC, and that period is unpredictable. It can last 3 years or 4 years or 1 year. It's unpredictable. So this is a critical time. This is last opportunity to create eggs or embryos or to get pregnant naturally or fertility treatment. In terms of naturally, you can try to conceive short period of time, but you should use a maximum, put a maximum effort to get as many eggs out. That's usually IVF. At this stage, it's IVF. So yeah, so this is a primarily determined by genes. It's nothing to do with what you have done, your lifestyle. It's not your fault essentially. Yeah. So when we say, oh, you didn't have a good lifestyle, you didn't have a good diet, this is no. It's primarily, we think age and genes approximately determines your egg quantity and quality by 90%. Yeah. So yes, there are some factors that can impact hugely, like surgery on the ovaries. You have a chocolate cyst and you had multiple surgeries. Yes, it can reduce your egg reserve. Or you had a chemotherapy or radiotherapy. These things can directly impact the egg reserve, because eggs are protected with multiple layers of cells. It's not easy to impact them with their quality or quantity. Why? Because this is only cell in the body which is created before you are born and until you use them after even maybe 40-45 years. And all other cells in your body goes through the mitosis, which means you keep replicating. So your body cells you have now were not there like last year. A lot of them are new. But egg cells are there since you're born. This is why the nature created them in such a way they have to be protected. And this is why it's not easy to influence them. So their sleeping state, fully protected, be inside your pelvis. Pelvis is most protected area in the body. Inside the pelvis, it's hidden. It's not only inside the pelvis, it's inside the inner pelvis. It's fully covered. And also inside the ovary. And then you have a multiple layers of somatic cells, which keeps each egg protected. So and this is why you cannot activate eggs until time comes, which is determined by AMH hormone, like we said yesterday. So yes, generally women who are going to have an early menopause or premature ovarian insufficiency have a very low AMH. Let us say if someone does AMH at the age of 25, if the AMH is 3 picomole liters, almost certainly they're going to have a premature ovarian insufficiency. Why? Because within 3 to 5 years, very likely they run out of egg reserve. It's impossible to tell in each person when exactly they will fully run out. Like we said, last phase of diminished ovarian reserve can be different in different women and can last long or short. That's from, we can predict until the age of 0, AMH of 0.6 and AFC of 3, 4. Then from there, we cannot predict exactly. But essentially, the main opportunity women have is before their AMH drops in such a low level, or egg reserve drops in such a low level, or before the antral follicles drops in such a low level. This is why I encourage everyone to be aware of their egg reserve, your AMH and antral follicle, and track. You don't have to do it every year. If you have high AMH, you have PCOS, you can do AMH once every like maybe 5 years or 10 years. You have average egg reserve, your AMH is 20, you can do AMH after 3 years, because we know how it declines. It's very predictable, it declines very slowly. But if your AMH is very low, you need to track and keep updating your fertility plans, natural, egg freezing, embryo freezing with partner sperm, embryo freezing with donor sperm, as soon as you have an opportunity to have a child. So essentially, you should stay on top of that AMH. So you have AMH curve, you have your fertility plan curve. If your fertility plan curve is falling behind AMH, let us say AMH is dropping here, like by the age of 35, and you are making fertility plans to have a baby at the age of 38. So which means that your fertility plan curve is not agreeing with your egg reserve curve, which means you need to get eggs out and then make sure that your reserve egg, frozen reserve, matches your fertility plan. So this is why you have to be aware. So our job as a fertility specialist is not only treat patients who come through the door. Yes, that's our job. But another job is to educate public so that they don't need this treatment. They can conceive naturally before it's too late. Yeah, so this is one of the reasons premature ovarian insufficiency and early menopause we have to be aware of, and that's genetically predetermined. Nothing to do with your fitness, nothing to do with your diet. That's genetically predetermined. So this is why you may be very fit. You say, I know my body, I am fit, I don't need to worry, I know my body. Yes, but you don't know your genes. You know your genes by doing AMH test, antral follicle count. Maybe 2-3 times you establish your reserve. Okay, my reserve is good, AMH is 20, you don't need to worry. But if it's low, you have to be very proactive in terms of making plans.